Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
Any reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before.
We are there when awful things happen to pick up the pieces.
We have a 2-year-old who's kicked by a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
Amy, selfie!
Down below. Too slow.
love
Such a good boy. So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
A&E.
On your good foot.
Okay,
On your good
I'm
foot.
a good foot. I'm a good foot.
James?
Oh,
It's good training, this.
I always use the right foot first.
Oh, no, you've got to use the other one now.
Just pop up onto the bed for me.
Today, Dr Mahinda is a neurologist on call in A&E.
How are you today? What's happened?
My official job title is Specialist Registrar in Neurology, which is brains and spinal cords.
Follow my hand with your eyes. I look up, follow my hand.
I was always very good at sciences at school. Enjoyed working with people, interaction with people, so medicine seemed like a good choice. Obviously, the parents were very happy.
Can you cock your... I like your slippers.
In retrospect, when I look back, I think, well, what do you know at 18? Not very much. When you're on call, you predominantly see patients coming in with strokes, which inevitably means you tend to spend most of your time, if not all your time, in A&E.
Can you lift up your left leg? OK.
It's much quicker pace, it's much more acute. You're having to make decisions quickly.
Is it the left leg that twitches more than the right, or is it both legs? OK.
Time is brain, basically.
And I think she's got some mild left-sided weakness.
When you see a patient having a stroke, this is a huge life event. This is going to make anyone really reassess things in their life.
Hello, St George's A&E. OK, go ahead. Yeah. 10 minutes. Thank you. Bye. Adult thrombolysis call, 10 minutes.
A 79-year-old grandmother is being rushed to St George's with signs of a stroke.
Adult thrombolysis call to A&E resus.
When you get the bleep, there's always an adrenaline rush because you're always wondering, well, what's going to come in the door? What story am I going to get?
The woman's son, Nigel, travelled with her in the ambulance. Her husband, Ted, is following by road.
We just watched the Palladium show on television. When I turned, she was just... You could see her eyes and that she just wasn't there. She was gone.
I was at home and the phone rang and it was my dad. We normally always catch up on Sundays. And Dad had asked me about work and what I'm doing the next day and so forth. But he was sort of distraught.
The panic inside me was enormous. I couldn't do anything.
Okay, so on my count, prepare to slide and slide. This is Carol. Carol is 79 years old. This evening, Carol's husband went to the room and noticed Carol with very confused, slurred speech, unable to get the words out, not making sense. Beforehand, she's been absolutely fine. Recently discharged from hospital. She's been investigated for a GI tract bleed.
Are they here?
Son's here at the moment. Husband's on the way, yeah.
OK, thank you. I'll let you book her in. Hi, Carol. Nice to meet you. My name's Mahinda. I'm one of the neurology doctors.
Yeah.
What's happened today?
We're high.
Don't worry. It's all right. You're having a bit of difficulty getting the words out. I guess the first question you've got to answer in your head is this a stroke? So 30% of what you see can present like a stroke, but isn't a stroke. Carol, I'm going to ask you to do a few things. Can you lift up your left arm?
Yes.
OK, can you put your arms down? Can you touch your nose just with your left index finger? Can you touch your nose with your left index finger? Stroke is where you have a cut-off in blood supply to a part of the brain. Can you touch your nose and then touch your head with your left hand? OK, so she can't follow one-stage or two-stage commands. And because there's a lack of blood supply and oxygen and nutrients to that part of the brain will die if not treated quickly. What's this? Difficult.
Yeah,
That's OK. What's these? Don't worry. I know it's frustrating.
She's always been a conversationalist. She had a very good brain.
So, Carol, I think you've had a small stroke. It's affecting your ability to talk to us, communicate with us, and also affecting your ability maybe to understand completely what I'm saying to you. So we're going to get you a brain scan, and then we're going to decide what we need to do, OK? OK.
She always told us that life's beautiful, life's a gift, and every day's a bonus. But then when it comes to it, it's very hard to accept that someone who you love like that might not be here the next day.
It's been 20 minutes since 79-year-old Carol arrived in A&E with a suspected stroke. She's being taken for an urgent CT scan to determine if she has a clot on her brain.
I was beside myself. I really did think she was going to die. I was 14 when I met her. I was rude to her, actually. But I was sitting on a wall in Park Walk at the church, and Carol was walking by with some shopping. She was young, but had a full figure. And I happened to mention about her chest, her breasts. And she come over and gave me a wallop, and I fell over the wall. That's true, absolutely true. That's how we met. But then I saw her again and I said, come on, jump on my crossbar on my bike and I'll give you a ride. Carol was my first and only love, really, truly.
Carol will return to resus whilst doctors await the results of her scans and carry out further tests to find out more about her medical history.
Hi, you Carol's son?
Yeah.
Carol's husband, Ted, is still travelling to the hospital from their home in southwest London.
So, tell me what's happened today?
Well, my dad called me, literally, I suppose, about 40 minutes ago.
Yeah.
And said, look, Mum's acting really weird, she can't speak to me. I think she's having a stroke.
I think she has had a small stroke.
Yeah.
And it's primarily affecting her ability to communicate.
Hello, Carol. How are you? Are you all right?
Can I just clarify a few other things?
Yeah.
The ambulance crew said she's had some bleeding.
Basically, let me start sort of...
So time is of the essence here, because in terms of me treating a stroke, time is key, so I'm going to hurry a little bit.
Yeah, they let her out of the hospital yesterday, and they see these cells bleeding.
Where was the bleeding?
Inside. I really
do you have any letters about that, or know what it was? The stools were black.
That's right, yeah.
OK, so they knew that she was having blood or bleeding from somewhere in her gut.
Yes.
Now, because you've caught this quite early, because this, we think, started about 10:35, normally I can give something to try and dissolve the clot that might be causing the stroke. It's called thrombolysis. It thins the blood, and typically there's about a 1 in 8 chance, if you give this treatment, patients make a good recovery.
Yeah.
But clearly she's had significant enough bleeding from the stomach. This could potentially trigger that and make it worse. And so I just want to go and double-check with the letters and make sure that I'm happy to give her the treatment, OK?
Yeah.
I'll come and get you shortly. If you wait here. Iron deficiency anemia, Melina. Hi, Usman. It's Mahinda. Can I just quickly discuss someone with you?
The CT scan shows a clot on the left side of Carol's brain, confirming she suffered a stroke. Dr Mahinda only has 4.5 hours from the time of the stroke in which to give her a clot-busting drug.
Carol, I think we should give you this treatment. There is a risk that it will cause more bleeding, but I think it's a risk worth taking. The quicker you can thrombolyse someone, the better. However, like all things, there are always exceptions. There will be times when patients won't recover that level of function of speech or language, absolutely. Do you understand what I'm saying to you?
Yes, I did.
Do you get it?
Hello, Amy, can I help?
My neck is killing me.
A little massage.
It's a chocolate, tea, coffee. Tea.
Moxie.
I don't think it's working.
77-year-old David has come to St George's with a swollen foot. He and his wife Kathy are awaiting the results of an X-ray before doctors can begin their assessment.
Hello. Yeah. Thank you. This must keep you very fit.
That's when these trolleys don't work properly.
Oh, don't.
Oh,
Thank you very much indeed. Thank you. I could do with a cup of tea.
No, there's lousy tea.
We are completely opposite. We always have been. Do you want something to eat?
Right?
Do you want something to eat?
No.
I've always been a romantic person, always. David's not a romantic. If you're going to stay in, I'm not going to make a pie then, that's it. I'm going to buy a pie now.
Well, if you buy one, you know how many carbohydrates are in it. That's the difference.
David has been diabetic since he was 15, and it's type 1 diabetes. I've probably lost my needle now. I've got so much of this wool. They went all through the family history, which they do, and there was no reason why. They could only put it down to the fact that David had a friend who died, and because he was young, apparently it was, you know, it was the shock. Well, you can't hear me, can you? I think I might as well speak to myself for the next few hours. He said the only good thing about it was he used to get extra rations of bacon on the ration book. It was when he got older that things started to happen. I was upstairs in bed reading, and he came up and he said, "Oh, can you have a look at my toe? I think there's something on it." I said, "Oh, yeah." I said, "There's a weeny little pinprick, David." In the morning, it had slightly developed. It looked, as my mum used to say, festery. They took one toe off on the Wednesday, one toe off on the Sunday. It was awful. David, I wonder if they've got anything that go over your foot for when you have a shower.
On what?
When you have a shower. They got anything that go over that?
Plastic bag.
Roy wraps his in cling film.
It's been 30 minutes since Carol arrived at A&E. Scans have revealed a clot in her brain.
Do you want to come through and see her?
Her husband Ted has now arrived to join their son at St George's. It's the first time they'll have seen Carol since she arrived in A&E.
You all there, Mummy? From the very moment I saw her, I wanted to be with her all the time. And I said, "I'd like to meet you, go to the pictures." Unfortunately, we didn't get there because she had her kidney was wrong. She finished up in St Stephen's Hospital. They thought she was going to die, and that, as a youngster, I ran in there and her family was round her, mum and dad and sister and what have you. And I just went right by them and I got hold of her and I just said, "You mustn't die, don't die, don't die." You know, I was 14. Her father wanted to send her to Switzerland, to a school, to get away from me, because he thought I was a right little Herbert.
You want to go ahead and give it? And then, can I just, before you do, just repeat. Can you name that for me? No, same thing. OK, so you can do that, just all dysphasic. So signs are unchanged.
Dr Mahinda must now give Carol a powerful drug in an attempt to disperse the blood clot in her brain.
So it takes a bit of time for this to work, so we're going to give it a few hours and see how she is.
If successful, the drug will help restore the blood flow and improve her speech, but it only has a 1 in 8 chance of working.
All right? Just try and relax now. Don't get yourself frightened. She's a chatterbox and she normally speaks very sort of, you know, gaily and, you know, kind of happy, and it was like a stranger voice to me. It wasn't my mum at all.
All right? I decided that I want to get married because it was always a bit frightened that something was going to happen to her, you know. My wages for the first week I went to work was exactly £1. £1. I was 15. Within the first couple of weeks of me working, I bought that wedding ring and hung it around my neck till we got married. We've been married now for 60 years.
I'm worried about my dad as well.
Okay.
Because he suffers from AF and he's really stressed out. And I can see he's feeling a bit tight in his chest.
Should we get him a chair? So listen, you did the right thing, calling an ambulance. You got her here pretty quick.
Yeah.
She's getting the best possible treatment that we have for stroke, OK? Yeah. It's going to give it a bit of time now. And you've got to try and look after yourself, because the last thing we want is you to end up in hospital as well.
I think I was as worried about my dad as I was my mum.
You've done everything you could, OK?
You do think your parents are going to be here forever. You just got to try and stay as calm as you can, Dad.
I'm sorry, but I can't. My son said, if anything happens to her, you won't be far behind her. Probably not.
Hunger Games or Battle Royale?
Hunger Games.
Lethal Weapon or Die Hard?
Die Hard.
Where's that orange pen again? Had it for 5 minutes and I've lost it again. Oh, my pocket probably. Oh, no. No. Oh.
Specialist nurse Maria is starting a 12-hour shift in minors. She's worked at St George's for 17 years.
I'm like this at home. Where's the phone? Where's the keys? Oh, God.
When I first came here, the A&E department worked out of a porter cabin. We wore frilly hats with a white apron and a belt. Now it's all, scrubs, which I much prefer. I did actually do a year in the bank, and I found that was not for me. It was the same people sitting in the same desks. It was very tedious. I thought, this can't go on, so I left.
Amaurosis furux. Sounds like something out of Harry Potter.
I think I'm a bit sort of quirky at work.
Yeah. This goes on your opposing shoulder. Now you need to watch how I do this.
Oh, no, I've learned for my first aid.
And where was it tonight, then?
To me, really, my job is a hobby. I think it's meeting people.
Now, you need to fold the hand underneath, like so.
It doesn't matter how many ankles I see, how many wounds I suture. It is the character behind it. I find that fascinating.
Hello? Yeah, I'm all right. I'm in hospital at the moment. My eye, something happened in my eye, innit? So I'll let you know if anything, yeah, what's happening. All right, then. All right, babe, bye.
33-year-old Ivet had come to A&E with an eye irritation.
Ivet! Hi there. Come through. Turn left. OK, take a seat for me. How can I help you?
Basically, yesterday I went to the salon to get my eyelashes done.
Oh, I see. You had them put on.
Yes, and I think the ladies either used too much glue and it's affected my eye. From yesterday, I've been seeing blurry.
So what do they do? Do they put a whole thing on or just one?
No, it's individual ones,
oh,
yeah.
Really?
And
I'll take it forever.
I've never been to a beauty salon. I go in the bathroom, 2 minutes and I'm out. I don't spend hours pruning myself. But I am fascinated about how it works.
How long does that all take then?
Probably about 30 minutes.
What, to do both eyes? Sticking them all on, one at a time?
One, yeah. And plus they use 2 packets, so it gives it a fuller effect.
Yeah, I see, yeah. So it's your right eye only?
Yeah, she did both eyes, but what happened was because she knew this one, because she knew that it was kind of like burning me.
Oh, yeah.
So she basically put another kind of hair glue on this one, so it wasn't burning me so much.
Oh, I see, different one.
And she went away and left me, came back, and it was still burning me. And she still charged me £15, even though she's burnt my eye out.
Right, sorry, what?
I have students living with me, and my whole bathroom is covered with their products. And they spend, hours in the bathroom.
I think I'm going to sue her.
Oh, God.
And I think I'm going to have to end up taking it off.
How do you do that then? Is that going back to her again?
No, I ain't going back there again, no. I probably won't have no eye left.
Right, any allergies to anything? Eyelashes. Could be one. OK, let's pour you into the eye room, which is opposite, and then we're going to just put some anaesthetic drops in your eye. Just follow me.
"77-year-old David has type 1 diabetes that resulted in him losing 2 of his toes. He's come to A&E because a 3rd toe is now possibly infected."
Do you want me to close that window? Do you want me to close the window?
Go on then.
You remember the first time you met David?
Oh, I can. It was New Year's Eve, and there was a knock at the door, and it was David's friend Peter, and he said, "We've got a party." So off I went to the party, and David was there. He was tall and very skinny and very, very quiet. You don't want anything to eat?
No.
I might have a jelly baby. At the end of the evening, I said, "Oh, well, I'm going home now." And David had to give me a lift home. He had to, because I lived over the road to him. David loves music, all types. He used to take me to places in Peckham, down underneath in the cellar, and they'd be playing all this country music that I thought was lovely. Never done any of that, and it opened up sort of quite a new world to me.
The X-rays of David's foot are now back.
Yeah, that toe's just disintegrating. I mean, that bone looks like it's eroded to me. I'm just going to do a Doppler on his foot. I think I'm going to have to speak to the vascular team. Right, young man.
Oh, I like the young. We wish.
So I'm just going to listen with the Doppler.
Yeah, I've had them
to
before.
the pulses in your foot.
Yeah.
Nurse Helen must now check the circulation in David's foot. The medical team are concerned that because of his diabetes, a lack of blood flow to his foot could lead to infection and ultimately amputation.
We'd only been married 2 months. He used to go to Hammersmith Hospital for his diabetes. There were guys in that ward who really worried David. There was a guy next to him. He was a police officer, and he only had 1 leg and no toes and all this, I said, "David, what's the matter?" He said, "He's diabetic." Diabetes has done that to him. I said, oh, my word. David said it's because he doesn't stick to his diet. He said he just eats anything. So from then on, I just thought, no, we've got to keep him healthy. And I gave him all the right foods. So I had to give up baking, if you please. I loved cooking. He would have loved a cream cake, but he never ate one, never.
The blackened area's been there for how long?
Yeah, quite a long time. 5 months, yeah, it has. And it's gradually got worse. Like, today, it's the worst it's been. Very nice, isn't she? Very nice, isn't she? I'm going to have to teach you to lip read. I'll tell you, I think there's a dead battery in that thing.
See, I heard that clearly enough.
Thanks again.
You take care now,
Cheers.
James. Bye-bye.
You are in the A&E hospital.
79-year-old Carol has been struggling to communicate after suffering a stroke at home earlier that evening. She's been given a drug to try and dissolve the blood clot in her brain, but there's no guarantee it will reverse the brain damage affecting her speech.
Have you got any pain? No, okay.
My mum works in a play school. Everyone knew my mum. She was any children on the estate who fell over, cut themselves, broke their arms, run up to Carol, and she's always seemed to know what to do to them, take them, you know, to the right place, say the right thing, and, you know, that's brilliant, really.
Yeah.
She always had a philosophy, but it was always to sort of treat people, you know, how you want to be treated yourself, and have time and patience with people, and you get out of people what you give. She's always the one, I suppose, who's been a bit more of the calming influence in my life.
It is in the thing.
I is in the thing.
I is in the thing.
There's something she's got somewhere in something that she's trying to tell us.
I know, in the thing.
I know.
I don't know what thing you mean.
But
What thing?
At home?
Carol, please, don't worry about anything.
Hang on a minute, just trying to write something down. What's that? You know her writing. Can you read that?
She's wrote Daddy Loves. It's very hard to try to explain why you love somebody. You love me to death and I love you. It's in her eyes and in her face. She's just got this aura about her. Don't worry, darling. You're in the best place. Try not to strain. Just relax.
I want in.
You want him to look after him.
Listen, I'm gonna be all right. Don't worry. I'm
looking after him.
I'm all right, darling. I just want the best for you. That's all. I just want the best. So I want you to relax. Come on, because we've got a lot of things to do in our life yet.
My father passed away 4 years ago, so he was diagnosed with lung cancer. And so over the course of the years, obviously a lot of hospital appointments, a lot of going to hospital and clinics with him. Have all these questions in your mind. And I guess there's a danger when you're doing this job day in, day out, that you kind of forget that aspect of things. And I think that gave me an insight into what it's like on the other side of that room.
I'm Dr. Mummy. I am.
I'm the doctor.
I'm the doctor.
So, Maya, what is wrong with you? Is it your belly? Is it this bit, see? What's wrong with you?
Right, open the eye. Hold it open if you need to. Yeah. I'm going to speed it up a bit now, OK? Sorry.
33-year-old Ivet came to A&E with glue in her eye after having false eyelashes fitted.
Right, we got to go through a litre of this. Yeah.
Isn't that enough now?
No. It's all right.
We've had a few people that have been to beauty salons and end up in A&E. There was one lady that came in and she actually had Botox. And she had lumps, a big lump here, big lump there, you know, just like swellings. I mean, she looked fantastic, I have to say. Not with the lumps, but before, she was, you know, remarkable.
Do you get this done often, then?
Oh, this is the third time I have it done.
The third time? Do you think you'll get your eyelashes done again?
No.
Oh, it's me again. Hello.
Hi.
Right. I think you should think again about going back to this woman.
This is the eye ointment, OK?
Yeah.
Help with infections and the abrasion.
Right, sorry. Hello, Mummy? Yeah, they're just giving me my eye things. I'm still in St George's, innit? I'm nearly finished now. Do you want to speak to the doctor quickly? The nurse, hold on. It's my mum, just to let her know about what happened.
Oh, hi there. Yeah, so basically she has a little abrasion in the middle of her eye. But I put some local anaesthetic drops in, which takes the pain away. But if the pain becomes intolerable between now and Tuesday, she's welcome to come back to A&E here. OK, no problem, that's all right. I'll hand you back to your daughter now. Here we go. Thank you.
Hello? Yeah, Mummy. Yeah, she is very nice.
A few weeks ago, I was in this shop and this lady came up to me and said, "I'm very, very sorry, but I've heard your voice somewhere before. Where have I heard it?" And then I said, "I work at St George's." She goes, "St George's? You treated me." And she said, "I must say that when I met you that day, the way you spoke to me, I knew that you were in control and everything would be all right." My sister was beside me and she said, "Are you sure it's the right person?" So that was really nice. I'm sure it almost made me cry, actually. The fact that, you know, what I said to her was reassuring enough for her to leave and know that she would be okay.
So you need to go turn left this way. You know, hit the green button on the right, you've passed it, reverse, come back. That green button on the door, yeah.
All right then. Thank you.
Yeah, perfect, OK.
David's type 1 diabetes has already resulted in him losing 2 of his toes. A third toe is now infected.
Hello, sir. My name's James. I'm one of the vascular surgery doctors.
A vascular specialist has come to assess whether the rest of his foot is also at risk.
How are you?
Well, apart from that, fine.
It is a bit warm and a bit hot, so I do think there is a bit of infection there. But there is a good amount of blood getting down there at the moment. So I think we need to have a look at this more from an infection point of view than anything else, all right? Probably be sensible to start with a course of IV antibiotics just to get it under control, all right?
Okay.
We'll get you some painkillers, more importantly, than those things. But I think we've also got to be relatively realistic that in the fullness of time, that toe might have to go.
Yeah.
Let's cross that bridge when we get there.
Okay.
Let's first get this infection under control
Right.
and see how we go from there, all right?
Thank you so much. Thank you. We've become closer in certain ways. I suppose because he needs me so much. Don't worry. I know it's not fair. I mean, he's, what, 78 next month? So, you know, he's sort of a really old man. I don't look at him as a really old man, actually.
David will be admitted to hospital while specialist doctors treat the infection in his foot to try and save his toe.
Are you going to be all right?
Yeah.
I think it's turned into a contented marriage. Don't mind me going? I'll stay if you want me to. No. He's always been quite an independent person. You know, I mean, a silly thing like after we had our dinner, he'd go make the cup of tea. Well, he still makes the cup of tea, but I have to go out there and get it and bring it in because he can't carry it. You want me to poke your walking stick through the window?
I suppose you could.
Right, take care.
Bye.
You're in good hands.
Yeah.
David. All right? Okay?
They're going to take you onto the ward. But this young lady's going to take you and look after you, all right?
It's been 30 minutes since 79-year-old Carol was given a drug in an attempt to break up the blood clot that caused her stroke.
Just relax. Right, there's nothing to worry about. Although our shape's altered, we've altered, everything's altered, I still love her as much now as I've ever done in my entire life.
Carol, you're going to go up to the stroke ward now. Your husband and your son is coming with us, okay? That's nice smile, thank you.
They still hold hands. Dad always still gets her flowers and every Christmas and birthday. They're like swans, aren't they? One's no good without the other one.
I know a lot of people said to me, why did you go back? Yeah, I couldn't be without my eyelashes because, you know, I feel lost without them.
They were thinking of taking his toe off, but as only half of it had gone black, they said it will fall off. I thought, oh, crumbs. I mean, it'll fall off in my front room, my cat gets it and bats it about. Can you imagine?
They said they'll keep her in and they'll get to the bottom of it. You just don't expect things to happen to you. Who wants to come into an empty house and go out of bed on your own?
I was determined I was going to get over it. I thought I'll do whatever they say and hopefully I'll get over it. It was our 60th anniversary on the 13th of August this year, and we went to our church where we were married, and we got photographs taken. And my granddaughter took those. It was a lovely sunny day, and we came home and we had Chinese. It was lovely, really nice.
So Georgia's recess.
Hi, Switch, Heli Park response team, all in position.
This is John, 52 years old. Approximately 2 hours ago, he was struck across the face with a golf club.
You can imagine how far you can hit a golf ball and what that can do to the contents of your skull.
This is a critical head injury.
And I just thought, is he going to end up paralysed?
Everyone,